Good morning, everyone, and welcome. It is 9:31, so we're going to go ahead and get started. I know Dr. Nakia Thierry is working on bringing the slide deck up. Allow me to officially welcome you all. It is a pleasure for us to present to you the 2025 through 2029 Older Americans Act State Plan on Aging. I'm Jamie Pope, and I am the section chief over our planning, monitoring, and data section here at CDA. I'm going to be going through the agenda this morning and just a couple of housekeeping items before we dig into the state plan. All right, so here is our agenda for this morning. As you heard, I am Jamie Pope. We're going to go through some housekeeping in just a moment, and then we're going to have a land acknowledgement provided by Lynn Fritz, licensed marriage and family therapist, and also a Carrick tribal descendant. Then we'll move to our welcoming remarks from Susan Damaris, our director here at CDA, followed by the Older Americans Act State Plan overview. That's going to be presented by Mark Beckley, our Chief Deputy Director. And that's going to kind of go over what goes into the state plan. What are the nuts and bolts of developing the state plan itself? Then we'll move to the OAA state plan goals and objectives themselves. That's kind of the meat and potatoes, if you will, of the state plan itself. That's going to be presented by Dr. Nakia Thierry, branch chief of our older adult programs. And then we're going to move back to Susan for our closing remarks. And then we're going to move to public comment, which is going to be chaired by Denise Laker, our deputy director for the Division of Home and Community Living here at CDA. All right, here's those housekeeping items. As you've probably already heard, this hearing is being recorded. There will be a public comment period at the end of today's presentation. Right now, all participants are muted and will continue to be muted until the public comment period begins. Closed captioning and ASL interpretation is available for this meeting. The raised hand feature is available during public comment if you'd like to use the raise hand feature to vocalize your public comment. But technology has allowed a couple of different ways for you to put up that comment. You could either use that raise hand feature, or you could go ahead and type your comment into the chat feature at the bottom of your screen. Go ahead and type it in there. We'll make sure it's captured. Also, at the conclusion of today's presentation, the slide will be available at the slide deck, and the recording will be available on our website at aging.ca.gov or on our YouTube channel. So with that, I'll go ahead and turn it over to Lynn for our land acknowledgement. Thanks, Lynn.
Thank you. Whenever I am offering a land acknowledgement or other ritual, I always begin with a sage and smudging. It's purification. And I also, as this commences, am reminded my father, Karuk and Hupa, my mother, Swedish. And so I invite us for just a moment to come together by closing our eyes if you're comfortable. And together we take a long, slow, deep breath in. And a relaxing exhale. And I want you to think of the Native people you know, and to think of the environment that we witness here in California. The beautiful mountains, the lakes, the rivers, the meadows, our beaches, the ocean, all these tributaries of life, and reminded that we as people are connected to all of life. And from a Native perspective, all life is sacred. So I offer this land acknowledgement, recognizing the diversity of the Native people, the indigenous people of California and across our nation. That we are different, we are unique, and yet we are one people We all seek to have our families be secure, to have a way of life that is beautiful and a blessing, to be able to embrace our challenges and to grow and thrive. So today, as we begin this meeting, we acknowledge throughout California the largest population of Native and Indigenous people in the United States reside here. We acknowledge the trauma that has been faced and the resiliency of the people, and that the land that we stand upon is considered sacred. So as we move into all of the meeting, all of our lives, each step we make, we remember and embrace this knowing, honoring not only the Indigenous people, but all people, all of life, two-legged, four-legged, winged creatures, our rocks and minerals, the life that fills our waterways, the plant life, and the life-givingness of water itself. We give thanks for the honoring. Aho. Thank you.
Thank you so much, Lynn. Thank you for that grounding. Thank you for inviting us to close our eyes. Thank you for the visuals. And thank you for your service on California's Master Plan for Aging Equity Advisory Committee on Aging and Disability. We appreciate your service there and your work in the North State. Thank you so much.
Thank you.
Thank you. Thank you. And welcome to everyone joining us today. We really, really appreciate you taking the time to learn more about our state plan on aging. This is a draft document, and today the purpose of our call is to educate you on the direction that we're taking, but more importantly, to hear from you about what matters most to you. We invite your public comment at the close of our presentation, and we want to hear from you. What are your priorities? What's not working? What do we need to emphasize? And what looks good in the plan? We welcome that comment as well. But please bring your perspective from where you sit today and the people that you serve and work with daily. This process, you'll hear more from our Chief Deputy Director, Mark Beckley, about the 4-year process that we work in partnership with the Federal Administration for Community Living. We are preparing this document for submission on July 1st of this year, and it will guide our work in the coming 4 years, 2025 through 2029. We recognize and acknowledge these are consequential years for older adults, people with disabilities, and family caregivers. It's very important that we hear from any of you who are joining today by raising your hand, but also in the comments section. And you may need some time to process the information. It will be a lot of information coming at you. We welcome your comments. We have an online survey that you can take and an inbox that you can send your comments to through the 21st of this month. So thank you so much for honoring us with your time today, for joining us, being open to listening and learning, and most importantly to us, to providing comment and perspective and input on this document and the work ahead for all of us. With that, I turn it over to Mark Beckley, our Chief Deputy, to walk us through the plan.
Great. Thank you so much, Susan, and good morning, everybody. So I will provide you with an overview of the Older Americans Act state plan and the process that we use to develop the plan. Next slide. So every year, the federal government allocates millions of dollars in funding to support the Older Americans Act programs in California. These programs provide a variety of services and supports to older adults and caregivers, including meals, health and wellness training, caregiver support, and legal services. To receive funding, California must submit a state plan on aging to the federal government once every 4 years. The plan includes information about the state's goals and objectives for the Older Americans Act programs and services for the next 4 years. Our next state plan begins October 1st, 2025. Next slide. The federal government requires states to inform its state plan from a variety of key sources and meet the following requirements: feedback from the public, including surveys and needs assessments, feedback from area agencies on aging in their plan and goals and objectives, input obtained through public comment period, and assurance that program goals and objectives have been established in accordance with federal requirements. Next slide. CDA drew on a variety of sources to inform its state plan. These sources include local area plans developed by the 33 local area agencies on aging. Every 4 years, the local area agencies on aging are required to develop local area plans, and these plans are informed by the needs of the communities that they serve. Federal and state statutory requirements, and the governor's master plan on aging, as well as the California Departments of Aging 4-year strategic plan. This past January, we just completed our latest state strategic plan, and this plan is available for viewing on our website. And finally, through a couple of public feedback collected in this forum, as well as 2 other public forums that we hosted, we will also have a public feedback survey available for you to complete. That will be on our website. The survey will be open until June 21st. Next slide. I would now like to highlight what's not included or only minimally referenced in our state plan. Again, the state plan's focus is on Older Americans Act programs provided through local area agencies on aging. CDA, in partnership with our local area agencies, as well as other partners, also provides some additional services that are not Older Americans Act programs and are only minimally referenced in our plan. These services include health insurance counseling and advocacy, or our HICAP program, which provides Medicare counseling, CalFresh Healthy Living program, caregiver resources, and the Office of Long-Term Care Patient Representative. Programs that are also vital supporting older adults throughout the state, but are not referenced in our plan, include in-home supportive services, adult protective services, and health programs. These are programs that are overseen and delivered by other state departments and local partners. However, I do want to note that in our state's master plan for aging, we do include these programs as well as several others. The state's master plan of aging is the state's comprehensive blueprint for housing, health care, equity, inclusion, caregiving, and affordability for older adults throughout the state. We're proud to say that we're now in the 4th year of our master plan for aging, and you can find more information about our master plan of aging through our MPA website at mpa.aging.ca.gov. Next slide. So I now want to talk about the California Department of Aging's role in administering the Older Americans Act. We work collaboratively with local area agencies on aging to administer, deliver, and oversee the services that our local area agencies on aging provide. These services include congregate and home delivered meals, caregiver support, disease prevention, health promotion and Medicare counseling, elder abuse, and advocacy for individuals with long-term care facilities. This is administered by our Long-Term Care Ombudsman program. Next slide. In terms of CDA's role in preparing the state plan, we do this in collaboration with our California Health and Human Services Agency, and we provide leadership and oversight over the Older Americans Act programs in collaboration with our local area agency on aging partners. The vision for the 2025-2029 state plan is to offer a variety of programs to further support aging and ability inclusive programs in California that empower all older adults to have choice in the programs that they receive to best suit their needs. And we do this through partnerships, advocacy, and outreach efforts. Next slide. So I now want to emphasize why it's so important that we focus on our state master plan, our aging the Older Americans Act state plan, as well as our CDA strategic plan, we know that the services provided through these programs are so vital and critical to support older adults, persons with disabilities, and caregivers throughout the state. And these slides demonstrate that while these needs have always existing, the older adult population is growing and becoming increasingly diverse, as illustrated through the data that I'm about to share. The first slide shows that older adults are the fastest growing population in the state, with percentage growth rates ranging from 12 to 138% by 2040. Whereas you see the population of ages 40 and below are actually seeing declines in growth rate. So we are seeing substantial and just amazing growth rates for older adults in California. Next slide. We're also very proud of the work that our research branch does. They put together these county profiles where you can see key demographic factors about older adults by county. The information includes age ranges of older adults, race and ethnicity information, growth rates, and metrics around key areas of need for our older adults, such as poverty, social isolation, housing, and language access. This helps our local programs identify the service needs and gaps for the populations that they serve, as well as opportunities to serve them better. Next slide. Now, this view shows the projected percentage increase of 60 plus populations between 1980 and 2060. And as you can see, all regions of the state, the arrows point up. We see that the older adult population is growing throughout the state, anywhere ranging from 125% to 428%. Next slide. And this final slide shows the raw number increase of older adults throughout the state between 2000 and 2040. And we see the largest increase occurring for the 75 to 79 and the 80 to 84 age ranges, from 876,000 to 855,000 respectively. Okay, so I'd now like to hand it over to Dr. Nakia Theory, who will go over the core components of our Older Americans Act state plan. Thank you.
Thank you so much, Mark, and good morning, everyone. Today, we are going to be talking about our OAA state plan goals and objectives, and we are very excited to be able to discuss our goals and objectives. I am very excited to be able to discuss our goals and objectives, and these are goals and objectives that we have over the next 4-year cycle. Our goals and objectives have been drawn from, as previously mentioned by both Mark and Susan, by the work of our state and our stakeholders throughout the state. We've had an opportunity to look at the goals and objectives that our area agencies on aging presented within their 4-year area plans that they submitted to us on last year. And we've drawn also from work and working in the community and work that our staff have done directly in the community and through our area agencies on aging. Now, today I will be presenting the goals and objectives, but I do want to mention that what is not being mentioned during this particular presentation are the strategies and outcomes that accompany those goals and objectives, all of which is listed within the actual state plan draft that you all will have the opportunity to review on your own. So without further ado, the very first state plan goal is to enhance outreach, information, and assistance. CDA will increase public visibility, raise awareness, foster engagement, and promote education for older adults, persons with disabilities, and family caregivers with focused attention on those with the greatest social and economic need. Now, there are several objectives that accompany this particular goal. The very first objective is to increase public awareness of aging services through targeted outreach. The second objective is to establish a statewide aging and disability no wrong door system, building a statewide service provider directory to provide person-centered navigation services to connect older adults, persons with disabilities, family members, and caregivers to a wide range of long-term services and supports and other services all in one place. So very similar to a one-stop shop approach. The third objective is to modernize the health insurance counseling and advocacy program, also known as HICAP, to ensure Medicare eligible Californians receive the insurance counseling that they need and successfully enroll in the insurance plan of their choice. The fourth objective is to increase awareness and outreach to family caregivers by aligning program outreach efforts with the actions under Goal 1 found within the 2022 National Strategy to Support Family Caregivers. The fifth objective is to improve emergency preparedness through a learning community that exchanges information, training, resources, best practices to prepare for disasters before they happen, to remain safe during the disaster, and to aid in recovery efforts after disasters occur, which, as we know, is also important to us, especially here in California and with the recent fires that we've experienced here in Los Angeles County. So we do know how important it is to know the processes and the preparation steps for emergency preparedness during the emergency, before the emergency, and after the disaster and our emergency occurs. The sixth objective is to promote the role and importance of the Long-Term Care Ombudsman Program, also known as LTCO, to help residents, families, and chosen support people to understand how LTCO representatives can assist the public. The seventh objective is to provide language access in Americans with Disabilities Act accessible programs and services with translation of all vital documents on CDA's website. The second goal within our state plan is to increase opportunities to age in place in home and community-based settings. CDA will support the ability of older adults and people with disabilities to age in the setting of their choice by expanding access to health and supportive services, nutrition, and family caregiver support, which I'm happy to say we currently do provide all of these programs through CDA and as executed and implemented at the local level through our area agencies on aging. The first objective within this goal is to strengthen OAA in-home services across the aging network through the delivery of person-centered services for all eligible Californians. The second objective is to improve the health and well-being of older adults by increasing access to congregate and home-delivered meals, nutrition counseling and education, and food assistance programs. The third objective is to improve the health and well-being of older adults by increasing access to health promotion programs and services. The fourth objective is to coordinate efforts between the Family Caregiver Support Program and local partners in order to strengthen and expand the accessibility of supportive services and resources that are person-centered for both the family caregiver and the care recipient, and that align with the actions under Goals 2 and 3 found within the 2022 National Strategy to Support Family Caregivers. The fifth objective is to strengthen leadership in the home and community living network. Now we will go into discussing state plan goal number 3, which is to prevent isolation, promote inclusion, and advocate for elder justice. CDA will seek to combat loneliness and isolation with policies and programs that ensure accessibility for all, including vulnerable populations who are at risk of fraud, abuse, neglect, and exploitation. The first objective within this goal is to expand access to OAA Title IIIB legal assistance services in order to ensure that more older Californians have access to a legal services program that works for them to protect rights and secure justice. The second objective is to improve the Long-Term Care Ombudsman Program's capacity to respond to concerns made by or on behalf of long-term care residents. The third objective is to promote strategies to reduce and prevent fraud, neglect, and exploitation of older adults and advocate for elder justice. The fourth objective is to support the behavioral health needs of older adults, adults with disabilities, and family caregivers in partnership with the Department of Healthcare Services, the Department of Public Health, and the Department of Healthcare Access and Information and Behavioral Health stakeholders. The fourth goal under our 2025 through 2029 OAA state plan is to strengthen partnerships. CDA will enhance communication and increase engagement with key stakeholders, including area agencies on aging, county government, tribal organizations, faith leaders, policymakers, community-based organizations, and healthcare providers. The first objective within this goal is to encourage and support local jurisdictions to develop, implement, and evaluate community-led local master plans for aging. The second objective is to expand access to Older Americans Act programs and services for Native American, Alaska Native residents, and tribal organizations. The third objective is to facilitate with county services, including Medicaid eligibility determination, adult protective services, in-home supportive services, housing and homelessness services, public guardian/conservators programs, emergency disaster response services, and veteran services, just to name a few, to support the streamlined access to coordinated services and better outcomes for older adults, people with disabilities, and family caregivers. The fifth state plan goal is to advance strategies to improve financial security and economic support. CDA will improve financial security and increase economic support for older adults, people with disabilities, and family caregivers by identifying employment opportunities, assisting with navigation of coverage and benefits, and removing barriers to access. The first objective within this goal is to increase financial security and economic support for older adults. The second objective is to assist Medicare beneficiaries with education and application completion through the California Medicare Improvements for Patients and Providers Act, also known as MIPA, project to improve access to the low-income subsidy, also known as LIS program, for Medicare Part D, Medicare Savings Programs, also known as MSP, and Medicare Preventive Services. And finally, the sixth goal of our 2025 through 2029 OAA State Plan goal is to support aging services providers statewide. CDA will equip aging services providers statewide with enhanced tools, training, and technical assistance to continue to deliver quality services to older adults, people with disabilities, and family caregivers. The first objective within this goal is to explore partnerships involving healthcare plans, long-term services and support providers, government programs, and other health entities. The second objective is to develop supportive services programs and tools that enhance the quality of aging programs and aging provider services delivery, especially in areas of greatest social and economic need. And the third objective is to streamline CDA's planning, monitoring, program operations, and fiscal processes related to area agencies on aging and the network of community providers. The fourth objective is to upgrade and integrate technology and data for action and performance. And finally, the fifth objective is to strengthen and support alignment between state and aging providers to achieve person-centered, data-driven, equity-focused outcomes for the growing and diverse population of older adults, persons with disabilities, and family caregivers in California. So as you can see, we have a lot to shoot for with this particular state plan and the goals and objectives that we have, and we are committed to working towards achieving all of the goals and objectives that have been referenced during today's presentation. I will now pass it forward to our director, Susan, who will come to you with our closing remarks. Susan?
Thank you so much, Dr. Thiry, and thank you again to all of our participants. This is now your time to take the floor. We really, really appreciate you joining us today, and we look forward to a continued conversation and dialogue with each of you. But for now, we will turn it over to Denise Leiker, who will open the microphone. And please, we invite you to share any feedback you have on what was just presented or anything that we may have missed in developing this draft plan. Denise.
Thank you, Susan. Good morning, everyone. So it is our time to stop talking and we want to listen. So at this point for our public comment period, we have two ways that you can make a comment. You can make a comment through the chat feature at the bottom of the toolbar for the Zoom, and that will come directly to us so that we can take that back in order to integrate into our final draft before submission, or you can raise your hand and be able to speak up here on the call live with us to be able to make your comments and give us the feedback, your thinking in terms of what's missing, what we should do more of, what we should do less of, and any additional information you think that we should be integrating into our final plan. And in order to raise your hand at the bottom toolbar on your Zoom chat, on your Zoom meeting, there should be a raise hand button available to you. So at this time, please feel free to raise your hand.
I don't see anything in the chat yet, Denise, and no one is
Okay.
raising their hand that I can see.
Okay, we'll give it another minute or two. And while you're thinking about questions you might have for us, we do have a third mechanism for capturing feedback and capturing your thoughts regarding the state plan. And that will be through our website. And as soon as we'll give it another minute or so to see if maybe I want to make sure anybody who would like to ask anything or be able to make any comments for us to consider. Want to give you a moment to give you that space to do so. But there will be a third mechanism of being able to submit comment through our website. And that comment period will be open till June 21st. And at that point, our public comment period for this cycle will close, and that we will be working on being able to bring the plan together for submission. Nikia, anything? Anybody?
No comments and
No
no
comments.
raised hands as of yet.
Okay. All right. Thank you so much for attending today. We are really pleased to be and welcoming any feedback that you have for this plan by being able to submit it to us through our website. Then at this point, if there are no comments today, we want to make this a plan that represents all of California. And we would like all voices to be heard in this. And with that, we need your help. We don't know what we missed, and we need your help being our proofreaders on this. So please do visit our website that's listed here at aging.ca.gov, where you will be able to find a survey link where you can fill out and share your comments, suggestions, and feedback with us. And with that will bring our webinar to a close. We do also, if you are interested in receiving newsletters, email newsletters on what is happening at the California Department of Aging, before you is a QR code that you could take a picture of and sign up to receive those newsletters, so that we can be able to keep in touch through that channel as well. And so with that, thank you so much for your time today and for attending. And we look forward to hearing from you very soon. Thank you.
Thank you, everyone.